Sunanda ji and Vijay ji, who will be taking the important topic of fitness beyond 55, क्योंकि normally 55 साल के बाद तो कहते हैं जी अब तो बहुत जी लिए जी, अब तो मजे आने दो जी, हम तो बस अब कुम जाए डॉक्टर मुदगिल की तरह, हमने बहुत तीर मार लिया जी। लेकिन क्या है कि श्री कुंभ जी तो 23 तारीख को समाप्त हो जाएंगे, जिंदगी तो उस वक्त से शुरू होती है। So there are very many ways to do it. And we have with us distinguished Sunanda ji and Vijay ji, and we welcome them to give their presentation. And
Thank you.
may I just introduce, हमारा छोटा सा परिवार है, लेकिन दमदार है। दमदार इसलिए है कि सब अपना अपना एक्सपीरियंस, 60-70 साल का एक्सपीरियंस लेके आपको मिलने आए हैं। और ऐसे इंसान को कहने के लिए कि तुम ठीक नहीं, जिंदगी नहीं ठीक तरह बिता रहे, तो एक खतरा भी है that they may turn around and tell the say, who the hell are you? I've lived for 70 years like a fit person. So who are you to two youngsters coming and telling me how to live? But that is the fallacy and that is the challenge. Because मैं सबके साथ एक चीज शेयर कर दूं, कोई भी बीमारी हो, चाहे मेंटल हेल्थ हो, फिजिकल हेल्थ हो, मेटाबॉलिक हेल्थ हो, एक चीज जो सब में काम आती है वो है फिटनेस। वन चेंज जो आप कर सकते हैं किसी भी बीमारी में, वो है टू रिमेन फिट। सो लेट्स लर्न फ्रॉम आवर टू यंगस्टर्स हाउ in a short period you can address your fitness. Please welcome your language of your choice. We are okay with English, Hindi, Punjabi, but maybe not Tamil. That's all.
Thank you, sir. Thank you so
Please,
much.
welcome.
Thank you so much. Yes, we would like to continue in English, and I can just manage Hindi here and there. Thank you so much for your kind words. And yes, sir, as sir was saying, it is so important that we remain fit. So if you ask us what is that we are doing? So the reason behind what we are doing is this. We have met so many clients in our, as a Pranita, you're in the last slide. Yeah. Okay. So we strongly believe that fitness is the key to the healthy golden years. And it is the mantra to stay healthy, to stay fit, and to be independent. All of us like to be independent, don't we? Right? And for that, what we require is fitness. So how do we get this fitness? Next slide, please. So over a period of, almost 20-25 years in our experience as a physiotherapist, we have met a lot of people who are in the age group of even 60 or a few in 80 years. So some of them who are in 80, we see them very, very independent. Some at 50 or 60 itself, they have a lot of ailments. So one common factor that was linking between them was nothing but physical activity and exercise. So more and more people who are more and more physically fit and engage themselves in physical activity and fitness on a regular basis or independent, and the quality of life, right? Today we know the life, it has increased. The life expectancy has increased. Now we have to increase the quality of life, and that is through exercise. And that is why we started this Growing Young Fitness program, which is exclusively only for senior citizens. So our aim is to produce a fit senior citizen community. Next slide, please. So what exactly happened? Recent times, the change in the population scenario is happening. Like the demographics is completely changing. With 65 and older are going to be about 997 million by 2030. So today, India's populations, in total population, about 8.6% is over 60. So what happens when more and more senior citizens are there and lesser number of the youngsters are there, then the dependency ratio changes, as a result of which there is going to be a mismatch. So this mismatch is something that is already happening. So in what way can we, arrest the negative effects of mismatch is to be, the mantra is nothing but to stay fit. Next slide, please. So today, if you see, Physical inactivity, right? It is called as a global pandemic. So we all went through a very bad pandemic called as the COVID, right? But the more serious problem is the physical inactivity. So lack of physical inactivity causes multiple issues. So the leading cause of hypertension, 51% of hypertension is because of physical inactivity. 48% of arthritis is again because of inactivity. Our heart diseases, cancer, and we know that India is the capital of diabetes. All of this increases because of physical activity, physical reduction in physical activity. So very sadly, this is the truth actually. 1/3 of the Canada population is actually inactive. Is only 1/3 is only active, and in US only 1/4 is active. So the rest of the population is actually inactive. So physical activity can be in two ways. One is not just about doing exercises. The second thing, what we call it, is something called as a sedentary behavior. So, as we age and as the number of activities or our responsibilities slowly come down, we tend to be more in a seated or a lying down position, which is more comfortable, right? So, this is something which is causing a major issue. So much so that we call sitting is almost equal to smoking, right? So, this is the problem with physical inactivity. While we have got rid of COVID from the world, physical inactivity is something that is still marking the world and causing a lot of issues across the globe, including India. Next slide, please. So, what exactly happens because of aging? Right? So we see because of aging, there are going to be multiple changes across the human body. So it is not just, it's not just a facial change as we see in this image. It's a change that happens across in all the systems. There are going to be changes in the bone, changes in the muscle. We have the cardiovascular system, the neurological, and the respiratory changes. What I would like to say is, while aging is inevitable, it is very, very beautiful if we prepare ourselves. So, Vijay will take you over to the changes, further changes because of aging.
Good evening, everyone, once again. So, we are very happy to meet you all today here. So yes, actually, changes are happening, like all the years, throughout the years in our life. So it is inevitable, right? So what happens because of aging? Yes, there are changes happening in our body, right? So, like changes are happening in all the systems of our body, right? In our bones, in our musculoskeletal system, in cardiovascular system, neurological, respiratory, in everything, there are changes happening, right? As we know, those are all now the common words, right? So changes in bones, right? So the question is coming here. We will come to the point next. So the changes in the bone. So in the bone, actually, the density of the bone, it's reducing, right? So we know the term, osteoporosis, right? Osteopenia, osteoporosis, those are all the bone density changes. So when ages are happening, the formation of the bone is decreasing. Always, for in our body, what is happening is bone is, like it will get degenerated and it will get regenerated again, right? So on particular age, what is happening? The regeneration is less. So the density of the bone is going to be less. So that's how we are getting this osteopenia and osteoporosis. And in the muscles, the size of the muscle, the strength of the muscle, it's getting reduced, and the tone of the muscle also, it's getting reduced. Even in cardiovascular system, there are changes happening in the blood vessels. There are depositions happening, right? And narrowing of the vessels happening. And in the neurological system, when you take, the reflection, the action response time, right? When we are taking the stimuli to the brain, how quick we are responding to the stimuli, that is changing, right? So if you ask a, small boy, to, throw the ball immediately, like the response, what we are getting from the small boy, if when you compare to the age of the 60 years old, it will be totally different. The quick response time is is getting more. And the respiratory changes again in the breathing, right, in our lungs. So in all the system, there are changes happening. So why we are telling this here? We are not scaring you, yes, these are all happen. No, how we are going to face this, with a positive attitude, and how we are going to maintain it by doing, few things, by doing few changes in our lifestyle. Definitely we can live a very, very positive life with a very, good health. Next slide, please. So what we are going to do? Yes, these are all changes happening in the body. So how we are going to address it, right? So World Health Organization. So this is the answer to the questions what we got in the chat box. World Health Organization is suggesting 150 minutes of moderate intensity activity. Okay, so we have to, note the words here. They are saying moderate intensity. So when you do exercises, just, by doing raising the hands, front and back, and going for a slow walk with a friend, and we can say, okay, I have done with my exercises. We cannot say. Here, what they are saying is 150 minutes of moderate intensity exercise. What is the moderate intensity of exercise? Right? So when you do the exercises, after at least 10 minutes of exercises, you should be, the heart rate should increase a little bit, and you should feel the increase in the heartbeat, and you should not be able to talk continuously a sentence without, taking the breath like that. So you should feel that. That is called the moderate intensity of the exercises. In that level, you have to do at least 150 minutes of exercises per week. When you are doing the exercises, at least the one session, it should be more than 10 minutes. It should not be less than 10 minutes. That's what, their suggestion from the World Health Organization. And when you do this exercises, again, it should include the strengthening exercises. Very, very importantly, for the old people, we have to include the strengthening exercises using, some weight cuff, or, there are many kind of strengthening exercises actually. Using our own body weight, we can do the exercises, and we can use the external weight, and we can, or external, there are using some props, we can do the strengthening exercises. But strengthening exercises and exercises to improve the balance should be included in our exercise routine. That's the World Health Organization guidance. Next slide, please. So why this regular fitness regimen is vital? Why should we do exercises, right? So we can ask, I'm doing, maybe all the women, they say, I'm doing all the work at home. That is enough. That is giving the physical activity. And maybe, I'm going for a regular walk. That is enough, right? So those are all the statements we are hearing from many. And, as I said, World Health Organization says, we need to do the strengthening exercises also. So why should we do? It reduces our risk for health problems. Many complications will start to come after, after the age of 60 years. There are many complications are developing in the body. So we can reduce all our risk problems by staying healthy, right? And it makes us feel better usually, and it's good for your brain. These both the points are, interrelated. It will improve your quality of life. How? Right? When you do the regular exercises, right? One thing what you are doing is you are doing good to your body. You are working your bones. You are working your muscles. And when you do the, aerobic activity, you are working on your heart muscle. Heart is, just a muscle, right? Cardiac muscle. So you are working on the muscle. So, you are doing good to your heart and breathing capacity. By doing the breathing exercises, we are increasing the lung capacity. So we are doing good to our physical health when you do the physical exercises. On the other side, when you do the exercises, in our brain, there are few hormones, happy hormones. It's called happy hormones. They are secreting when you are doing the exercises. You will feel good by yourself, and our brain will thank you to do the exercises. So it increases your quality of the life also, because when you do the balance exercises and all, balance exercises are very, very important, because the risk of fall is more when you get aged. So by doing the regular balance exercises and all kinds of exercises, we are taking care of our physical health, mental health, and as a whole, we are improving our quality of life. Next slide, please. So, like as we both are physiotherapists, me and Sunanda, we both are physiotherapists. So when we think about all those things, we came to an idea of exercise program called Growing Young. So our program is called Growing Young. That's how we planned this. This is the fitness, holistic fitness program and customized fitness program for 55 plus years. So when we thought of it, when we were treating the people, they came for some ailments, and we will treat them, and we will teach them few exercises, right? They will go and they will do for a few days, and they will just leave it. Okay, right? So again, the pain will come. Again, they will come to us. So we have seen that they are not continuing the exercises, and they are not taking care, right? So at that time, we have thought of this program. So how come, how we can make them to work out continuously, right? So what will be the effect? That's how this Growing Young came. So when we implemented this program, all of our clients, when they are doing this, we are seeing a very big difference in them. And 4 months once, we are assessing their aerobic endurance, agility, and strength level and everything. We have seen a very good difference in the all the parameters compared to 4 months once. When we are doing it, we are seeing a very good improvement. So usually, these are all the components of exercises we can do regularly, right? So always we should start with a warm-up exercises. So the warm-up exercises is to get the full range of motion in all the joints. We are trying to work all the muscles and all the bones, right? So to the full range. That is the benefit of warm-up exercises. Then next, breathing exercises is another component. So what is the help of breathing exercises? It improves your lung capacity, right? There are different kind of breathing exercises. When you're doing it regularly, you can stimulate all the lobes of the lung, and you can increase your lung capacity. And the aerobics exercises, it is very helpful for your cardiac muscle, right? So the next one is stretching exercises. The stretchability, the flexibility of the muscle improve when you do it continuously. It will help you, to maintain the flexibility and to increase the balance also. It will reduce the fall of risk actually. And the strength training, again, it will help to your bone strength and muscle strength. It is very, very important. While in the old age, to do it is very, very important. And the balance exercises to reduce the risk of fall. Core strengthening exercises, again, the main one, like the pelvic floor and the lower abdominal and the lower back muscles, we can work for it. And the brain stimulation exercises to have the good mental health. So these are all our, parts of the program. And, you can do all these components of the exercises in an everyday basis to make benefit out of it. Next slide. Sunanda is taking over.
So what should be, as a senior citizen, when you're taking up a fitness regime, what are the things that you have to follow? So when we see a lot of clients, what happens is most of us tend to follow a YouTube video or to do the exercises. Is it the right way to do it? Certainly not. So what happens here is, for each person, right, our fitness is going to be different. Our body issues are going to be different. The problems and ailments are going to be different. So what we need here is, first and foremost, is a medical pre-evaluation. The first step, you will have to evaluate yourself with your doctor or your physiotherapist or your fitness instructor to understand what your body is and how your body is right now. So based on that particular assessment, you have to go choose a holistic fitness program. So as Vijay was telling, most of us, whenever we meet senior citizens, they say, I am going for a walk, right? That should be enough. Is it right? No, certainly not. Because even the World Health Organization recommends strength training and balance training, right? So it is not just about walking and improving your cardiac activity. It is about even walking. You'll have to know how to do the walking, how much, at what pace you have to go. That is going to be different for each person. It does not depend on the age. It is going to be different from each person. Here again, the role of an expert is very, very important. So after that, we have something called as there should be a follow up. Now you have taken up an exercise program, you're doing some exercise for a regular period of time. What have we achieved? Where have we moved from others position? So that is what is the follow up that is required. And it is also essential to get updated, like what all of you are doing, like the Wellness Chaupaal, where you keep attending to webinars by different industry experts, giving you the experience and expert advice will certainly help. So this is how when you're signing up for an exercise program or taking up an exercise regime, make sure that all these components are addressed. And this is how we take our program as well. Next slide, please. So now that we know that aging is inevitable, and what do? We have to do something about it. And the only way to do is to start with exercises. But can I just start off? I've been not doing an exercise for a long time. Suddenly, I just get up and start walking for 1 hour, 2 hours. Is that the right way to do? Certainly not. So start any activity when you're starting. Start with a minimum of 10 minutes initially and slowly increase the duration. So every minute actually counts. Every minute of activity is very, very important. So as I mentioned earlier also, sedentary behavior is very, very dangerous after 60 years old. So even if you're watching a TV serial or if you're watching a movie, what you could do, pass every half an hour, take a quick 2-3 minutes walk. That way we break the sedentary behavior and give our body some kind of a physical activity. And secondly, active time can be social time, right? So here there are two ways to look at it. So you can probably engage with a group of friends to do a physical activity. It could be a dance, it could be a walk, but if you're going for a walk, make sure that you choose somebody who can walk at your pace. I normally say this, right? Don't walk the talk, right? So you keep walking, and at the same time, if I'm able to converse with my friend or converse over a phone, it means that we are not stressing ourselves as much as we can. So if, what we can probably do, finish off your walking, then get together and have some fun. So that way your mind also gets better and your body also gets what it requires. The third point, walk wherever and whenever you can, right? Instead of, a shop close by or any other, things errands that you want to do. If it's something walkable and reachable, please take your legs and don't use your vehicle to reach there. And as I told you, start slowly. Don't start on one day. Don't start with 40, 50 minutes. Start with 10 minutes, then increase it gradually. Listen to your body, right? So post 55, we are very likely to have some arthritic issues, osteoporosis issue, or many other issues which can cause body pains, joint pains, or overall tiredness can also happen. Or if you're a diabetic and you go for an early morning walk, possibilities of a hypoglycemia, low sugar level is there. So all of this can happen. So always listen to your body. If your body is resisting, there is nothing else better, right? Please listen to the body and probably take a small break that particular day and refresh yourself, and you can do it the next time. Don't give up, right? And every step counts. As I told you, just keep walking, keep moving whenever and wherever you get. Don't sit in one particular place for more than half an hour. Every half an hour, make sure that you take a break from your sedentary behavior. So these are some tips for you. to help you stay active. So here we are presentation. We didn't want to focus too much on the presentation because again,
targeted method of telling our elders how important it is, but how simple it is. And मैं सिर्फ एक बात कहना चाह रहा हूं, इन्होंने बार बार एक बात कही, that inactivity is a behavior problem. मैं आप सबको ये इसके बारे में थोड़ा सा 2 मिनट बोलूंगा before you listen to this, because why, what they are going to show you now, उसको ऐसे मत देखिए कि एक व्हाट्सएप गाने आप सब हम सब देखते रहते हैं. दिस शुड अपील टू योर बिहेवियर. और बिहेवियर क्या है? बिहेवियर हमारी सोच के साथ ताल्लुक रखता है. हम पहले ये माने कि हमें फिटनेस रहना है. हम पहले माने कि मैं लेजी इंसान. ये दो बातें जब आप मान जाएंगे, यस मैं लेजी इंसान हूं, मैं 2 मिनट में बहाना मारता हूं, आज ना धूप नहीं आई, आज ना मेरे पड़ोसी ने दूध देर में दे दिया, any excuse in the world, and you have forgotten about your fitness. So what they are going to show you now, please see it carefully, try and adopt it, and if anybody is interested.
So first we are going to do some warm-up exercises. As we said, warm-up exercises are targeted for full range of motion of each and every joint of the body. As we don't have much time today, we are going to just do a sample of exercises in different categories. Okay. So first we will start with the warm-up exercises in sitting position itself. So come sit straight. Make your spine straight and sit straight. Don't lean on the chair. Now we are going to lift
please
your...
request, please do try it with us. You can also do the exercises. It's really simple as well as very effective.
Yeah, requesting everyone to do with us, and please switch on your cameras also so that we'll be able to guide you. Now we are going to lift your both the heel up. At the same time, bring your hands up fully to 180-degree, palm facing forward direction, and then heels down and hands down. Shall we do? Ready now? 1, 2, 2, down, 3, down, 4, down, 5, down, and relax. Now stretch your both the legs little to the front. Now we are going to lift your both the heel up nicely and bring your hands to the front. Now we are going to just push your ankle down and try to place whole foot on the floor. At the same time, we are going to stretch your hands to the side and then bring it to the front again. Ready now? So only heels on the floor. 1, front. 2, front. 3, front. 4, front. 5, front. And relax your hands. Now widen your legs in the chair. Join your hands, interlock your fingers and place it as ulta. Bring your hands up nicely. Now tilt your body to the right, neutral. Bring your hand down. Bring it up, tilt to the right, up, bring it down, up, tilt to the right, up, and down. To the left side now. Up, tilt to the left, up, and down. Up, tilt to the left, up, and down. Up, tilt to the left, up, down. Relax and take your legs to the front. Now come little forward in the chair. Widen your legs. Both the hands on your knee. Now from here, stretch back nicely and then curve and tuck in your chin to the chest. Stretch back and tuck in. Stretch back, tuck in. Stretch back, tuck in. Stretch back, tuck in. One more time. Fresh back, tuck in, neutral, and relax. Now, please all come to the standing position. Have the chair near you. Take the support of the chair always when you want support. Now, we are going to bring our opposite side hand and leg out. So take your left leg out, right hand up and bring it down. Ready now? 1, down. 2, down. 3, down. 4, down. 5, down. Repeat the same with the other hand and leg. 1, back. 2, back. 3, back. 4, back. 5, and back. Now do the shoulder rotation in full range. Keep your elbow straight. 1, 2, 3, 4, 5, 6. Reverse it. 1, 2, 3, 4, 5, and 6. Widen your legs a little bit. Hands in the hip. Do the hip circles. 1, 2, 3, 4. Reverse it. 1, 2, 3, 4. Now make a thumbs up position. Thumbs down. Now bring your hands back to the front. Thumbs up. Thumbs down. Out. To the front. Up. Thumbs down. Back. To the front. Up. And relax. Elbows stuck with the body. Do the wrist movement. Down. Up. 2. Up. 3. Up. 4. Up. Wrist rotations. 1, 2, 3, 4. Reverse it. 1, 2, 3, 4, and relax. Please have a seat. So these are the few samples of warm-up exercises. So whenever you practice the exercises in the form of warm-up, please make sure that you are moving your every joints in a full range. That is very, very important. For example, in everyday life, when we are lifting the hand, we will do only this much only. This is the functional range. We will not go up to this, right? So when you do the exercise only, you will lift your hand in this position. Like that, each and every joint, it has a functional range and it has its original full range of motion. So every time when you do the exercises, make sure that you are moving it into the full range. Thank you. We will move to the next part now.
Of exercises that we are going to do is stretching. So because of aging, what happens is there are certain depositions called as collagen deposition, which can happen in your muscles and your ligaments. So all of it will actually reduce the flexibility of the muscle, and because of which you will not be able to stretch yourself completely. So by doing the stretching exercises, we are trying to lengthen the muscle. So that way your flexibility and your range of motion can be attained. Apart from that, stretching plays a very, very important role in balance. Say, for example, when I'm trying to trip, if there is a trip, the opposite group of muscles get stretched, right? Unless it is fully functional in terms of strength and flexibility, I will not be able to regain and get back to onto my toes. Otherwise, I'll tend to fall down. So that is why flexibility is very, very important to maintain your balance and improve your balance, and also for your daily activities as well. So here we will demonstrate a few stretches. So the first one for the shoulders. So another important problem of aging is what happens is we start going down. So there is a curvature that develops, right? We start stooping. So we have to break that posture. So this happens because this muscle becomes tight and the one at the back gets stretched and it doesn't have the strength. So now by doing this exercise, we are going to open out the chest and clear the posture issue. So place your hands, join your hands in the front, stretch your hands to the back. So this is the normal level. Now try to push your hand back as much as you can. You can all be seated and hold. 1, 2, 3, 4, 5. Come to the front and hands down. So you can
Don't
all
drop
feel
the arm level.
You can all feel the shoulders getting pulled, right? We are opening out the kyphotic, the stooping posture while taking your hands at the back, right? So we are going to try and maintain at shoulder level. Don't pull your hand down. So it should be at the shoulder level itself. Let's do it again. Join your hands together in the front. Now stretch back as much as you can and hold. 1, 2, 3, 4, 5. To the front, hands down. One more time. Join, stretch and hold. 1, 2, 3, 4, 5. To the front and bring it down. Can you all feel the stretch? Can I have a thumbs up? Yeah, thank you. Now we will move on to the next stretch. So the next one, we are going to focus on the side. So again, this is also a very common problem that comes. So the side tilting, the body, the spine can tilt like this. So this will kind of become more and more tight, as a result of which the tilting reduces. So the tilting actually not only helps in stretching, this part when you stretch, it means your, the rib cage also spreads. So that also pulls apart and can help your breathing capacity as well. So let's do a small stretch for the side muscles. Spread your legs as much as you can. Interlock your fingers and lift it up. Try to keep the elbows straight. Okay, pull yourself and keep your elbows straight. Now tilt your body to the right and hold. 1, 2, 3, 4, 5. Up. Bring it down. You should all feel a nice pull on the left side. Again, lift it up, tilt to your right and hold. 1, 2, 3, 4, 5. Up, hands down. Now let's repeat the same by tilting towards the left side. This time you should feel a good pull on the right side. Let's begin. Lift up, tilt to the left and hold. 1, 2, 3, 4, 5. Up, hands down. One more time. Both the hands up. Tilt to your left and hold. 1, 2, 3, 4, 5. Up, hands down, and relax yourself. Now we will do a small stretch for the leg muscle. So come a little forward in the chair and stretch both the legs to the front. Now my foot, if you see, it is in the neutral position. My knees are also straight. Now pull both the foot towards you. When you pull it, you should find a good stretch in the calf muscle. Feel the stretch, hold for 5 counts and relax. Let's begin now. Pull the foot up and hold. 1, 2, 3, 4, 5. Relax. So please make sure that your knees are straight. If you bend your knee, then you will not be able to feel the stretch. So come a little forward like how I'm seated. Stretch the leg. Make sure the heels are on the floor. Let's continue. Pull the foot up towards you and hold. 1, 2, 3, 4, 5. Relax. Let's do it 2 more times. Pull it up and hold. 1, 2, 3, 4, 5. Relax. One last time. Pull the foot up and hold. 1, 2, 3, 4, 5. Relax and bend your leg. So we have demonstrated three stretches, three very important stretches, which you can probably do on an everyday basis, because these are common problems that happen to 60 plus. So please make sure you can do this. And while doing the stretching, all you have to do is you have to feel a pull. Don't go into the pain range. Just feel a small pull of the muscle and then relax. You also have to hold it so that the muscle's flexibility can be regained. Now, yeah, thank you.
So now we are going to do few minutes of aerobics exercises. Okay, aerobics in the sense we are not going to do jumping at all, just with the marching. We are going to do some brisk movements. Okay, ready everyone? With the music. Ready everyone? Please start your videos. Start marching. March. 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 Ready now? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hey, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Front step. 1, 2, 3, 4, 5, 6, 7, 8. Hey, 1, 2, 3, 4, 5, 6.
Rakesh sir, please continue in sitting position. Rakesh Bhargava sir, please continue in sitting position.
And the next level. Ready now? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And mark. Widen your legs. Elbow step. Ready now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And march. 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 We are going to do the kick and punch with opposite side hand and leg. Ready now? 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5. Already 5. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And march. 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 Widen your leg. Down recess. Ready now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up. 1, 2, 3, 4, 5, 6, 7, 8.
मंजित मैम थोड़ा धीरे कीजिए.
Front. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And march. 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 Take your hands to the side. We're ready now. 1, 2, 3, 4, 5, 6, 7, 8. Down. 1, 2, 3, 4, 5, 6, 7, 8. And march. 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 Knee centers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And march. Now widen your legs. Hands to the side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly to the right. Slowly to the left. 1, left, right, left. Now march me. Right, breathing. Run your movement. Widen your legs, widen your hands, straight up, and relax. Now, so this is the sample of the aerobics exercises, what you can do, right? So usually, up to in our session, in our growing young session, we usually do up to 13 to 14 minutes of this kind of exercises, and all the senior citizens are able to do this with us actually. But only thing, we will not ask them to do it in our pace. They will ask them to do in their comfortable level, right? This is a very good exercises to improve your stamina, endurance, and the cardiac health. So you can
with strength. So there are different ways of doing strengthening exercises. One, we can use our own body to do it, or our own body weight, or we can use an external weight like a dumbbell or a weight cuff, or we can use something like a TheraBand also to strengthen. So today, two different types of exercises I'm going to demonstrate. One is something called as in isometric exercises. So by the term isometric, we mean without changing the length of the muscle, we are going to strengthen, right? So the first one, join your hands together in front. Make sure your elbows are out. Now give a pressure with both the hands, give a pressure. When you press, you will feel that the whole arm is, the muscles are getting activated. Hold for 5 counts. 1, 2, 3, 4, 5. Relax. Can you all feel that tightness happening? Can I have a thumbs up, please? Yes. So this is here. Are we doing any major movement? No, there is no major movement. We are placing the hand in one position and we are strengthening, right? Let's do it again. Join it together. Press and hold. 1, 2, 3, 4, 5. Relax. One more time. Press and hold. 1, 2, 3, 4, 5, and relax. So isometric exercises are very safe to do. Even when you have an acute pain, you can certainly do the isometric exercises. Now the next one, I'll just show a small demo of transferring the weight. So widen your legs and place your hands in front of the chair. Okay. Now just go into half standing. So when you go into half standing, we transfer weight on the leg as well as the wrist, right? And hold for 5 counts. 1, 2, 3, 4, 5, and down. So our body weight, actually we are using our body weight to strengthen the wrist and our foot as well. Let's do it again. Halfway and hold. 1, 2, 3, 4, 5, and down. One more time. Halfway up and hold. 1, 2, 3, 4, 5, and down. Okay. So this is one way of using our body weight to strengthen the muscle. Now please come to the standing position. Now the next set of exercises, we are going to repeat a few movements, and by repeating, we are going to strengthen the leg muscles. So the first one, please take support of the chair on the left side. Now lift your right leg up to the 90 position, then stretch your leg to the front, again bend and place it down. So this is the movement that we are going to repeat for 5 times. So please come to the standing position and take the support of the chair using your left hand. Let's begin now. Up, stretch, up, down. 2, stretch, up, down. 3, stretch, up, down. 4, stretch, up, down. 5, stretch, up, down, and relax. Now take the support using your right hand. Let's do it for the left leg now. Left leg up, stretch, up, down. 2, stretch, up, down. 3, stretch, up, down. 4, stretch, up, down. One more time. 5, stretch, up, down, and relax. So when we are repeating for 5 times continuously, you can feel a little bit of heaviness around your thighs, right? So this way, by doing a repeated movement, we are strengthening the thigh muscles. Okay, just one more quick movement. So place your right leg in the front. Again, take the support of the chair. Now slowly bend down as much as you can and come up. This is again, we are using our own body weight to strengthen the leg muscles. Go down and up. Go down and up. Take your right leg back. Left leg to the front. 1, up, 2, up, 3, up, and relax. So by by doing the strengthening exercises, it is not just the muscles that get strengthened. Our bone also gets strengthened, indirectly. And for osteoporosis, which is very, very common after 60, especially in women because of menopause, and these days it is common for men as well. So this strengthening exercise, while doing the strengthening exercise, the muscle is getting pulled, right? So the muscle will tend to pull the bone, and by that action, actually the bone osteoporosis, that is the bone formation, also enhances. So we can reduce and keep osteoporosis under control. So that way, strengthening is not just about muscles, it is about strengthening the bones as well. So because of the lack of time, we are having a very quick demo with just a few exercises which you can practice on a regular basis. Yes, sir. Over to Grival, sir.
Thank you so much, Sunanda ji and Vijay, for this practical demonstration. I'm sure all of us have enjoyed it. One question. Before somebody gets into it, अगर आप सबने इनका पहला स्लाइड या दूसरा स्लाइड अगर आपको याद हो, उन्होंने कहा था, लिखा हुआ है, get a assessment done as to what exercise you can do. Remember, इन्होंने जो एक्सरसाइजेस बताई उसमें दम तो कहीं पे भी नहीं लग रहा, पहलवानी नहीं है, पहलवान नहीं बना रहे आपको. It is removal of your stiffness. But everybody can't do all of them. This is a range. लेकिन एक मैसेज ध्यान से सुनिए, उन्होंने क्या कहा कि एक होता है हाथ के मूवमेंट की फंक्शनल लिमिट. आपने अगर आटा गूंदना है तो ये मूवमेंट करके भी आटा गूंदा जाएगा, लेकिन अगर देखा जाए आपके बाजू की रेंज क्या है, वो यहां तक जाना है. So stiffness will go, what I think Vijay said or Sunanda said, you talk to people, they say मैं घर का सारा काम खुद करते हैं जी हम. घर के काम से स्टिफनेस नहीं जाएगी, क्योंकि आपका जो हाथ और पैर का मूवमेंट है वो इस दायरे के अंदर रह जाएगा.
Restricted.
That is important. So what they have shown, how much your hand should move for stiffness. And how often, either of you can answer this, how often do you find that in the elders who have, bad knees, dard hai, ghutne mein pain hai, how much of these exercises that you showed for stiffness can a elder indulge in?
So how much they can do is what you're asking?
Yes.
Okay. So that is again, it depends on person to person. We'll have to evaluate.
Your internet is not good. Just a second, I'll continue.
Yeah.
Yeah. So, actually saying, when you come to this exercises, it depends the type of exercises, right? Again, so, like, for example, warm up and stretching exercises, those kind of exercises you can do, right? Whatever the pain-free range you can do. And after that, gradually, we should increase the range of motion. In that way, it will work. Right. So that's why, like in our growing young program, we do the evaluation, right? So should go under the professional guidance. Don't do it by yourself.
By yourself. I was
Correct.
waiting for that line to come.
Right.
सारी चीजें बताई हैं, घर पे मत ट्राई करिएगा जब तक आप एक प्रोफेशनल को सलाह ना दें कि मेरे शरीर के लिए कौन सी एक्सरसाइज है. एंड रिमेंबर, आई थिंक आई शुड स्टॉप यूजिंग द वर्ड एक्सरसाइज. मेरे लिए कौन सी मूवमेंट्स हैं. These are not exercises. These are movements to remove your stiffness. Exercise बाद में आएगी, पहलवानी बाद में आएगी. Yes, Mr. Batra, please go ahead with your question.
Yeah, there is a question. What about breathing? Should it be normal throughout?
Yes.
When you're doing this exercises, yes, it's a normal breathing only. When you do the breathing exercises only, we do with, like inhale with nose and, exhale with breathe in through the nose and breathe out through the mouth. Like that, different types of techniques will come. But all these other kind of exercises, when you do it, the normal breathing is enough, actually.
Because remember, इनकी स्लाइड में एक और बात कही थी जो आप सबके लिए कॉशन है. अपनी लिमिट से बाहर नहीं जाइएगा. अगर आप 10 मिनट एक्सरसाइज में आपकी लिमिट है तो 8 मिनट करिएगा. डोंट स्ट्रेच योरसेल्फ, बिकॉज उन्होंने कहा सिर्फ स्ट्रेच फील होनी चाहिए. सो डोंट गो बियॉन्ड. यस मिस्टर बत्रा, प्लीज गो अहेड. नो, आई कांट हियर यू मिस्टर बत्रा. आपकी आवाज नहीं आ रही मिस्टर बत्रा. नहीं, I can't hear you.
Yeah, I think it was muted now.
Yeah,
okay now?
Please go ahead. Yes, please go ahead.
Okay, my question is partly answered, but not fully. See, what I want to say is in this group where you are giving this demonstration, people are from 55 to 85. So 30 years is a big range. My question was the intensity of the exercise, what you demonstrated. Is it for which group? Is it for all senior citizen group or this one? Partly you have explained, you evaluate and all that. But how to make a approximate guess and to know that, yes, this is sufficient for me?
So here,
any guesswork will fail हो जाओगे, number नहीं आएंगे.
Right. Say age is just a number. So as we were telling you earlier also, right, there are people who are 80 and even 86, in fact, who are doing it at this intensity for a 13-minute workout also, actually. So that is why when we evaluate, we will understand what is their fitness level and how much they can do, how much they should not be doing, right? So we, our sessions will always be like how we did today, right? One of us doing the demo, the other person is sitting and watching all of you. So then and there, if there is a problem or there is some specific instruction to be given, we tell right there so that, you can stop the exercise or proceed the exercise. And that is how it actually goes.
I think what Mr. Batra wants to know, is there age-based exercise? Mr. Batra, there is no age-based exercise. I have a person of 92 years who does 5 kilo dumbbells every day.
True, very true.
Gentleman at 55, you give him 1 kilo of weight or he comes, एक हफ्ते तक उसको बाजू में दर्द होता है.
Absolutely.
So exercises and fitness is not age-based at all. I think both of you will agree.
Totally. That's what we see also. That's what we see. Somebody at 55 are not able to do something.
In fact, ये भ्रम, this myth has to be broken.
Right.
Till you live, you have to be fit. Till you live, you have to be fit. And to be fit, you don't have to have a stiff body. The stiff body is your dushman. Yes. Any elder beyond the age of 65, किसी भी बीमारी की वजह से, अगर एक हफ्ता, if they are in bed, they lose their body flexibility by 25%. Am I right or wrong, Vijay and Sunanda?
You're right.
So 25% you will become stiff अगर एक हफ्ता आपको लेटना पड़े. So you can imagine somebody who's been in bed for maybe 2 months and then he comes to you and says, मुझे कमजोरी है. He does not require vitamins. He does not require intravenous glucose. He requires his stiffness to go. And it is not कि stiffness में जाके वो चार्ट लाके बैठ जाऊं YouTube देख के and I follow the exercises. No. You have to have professional guidance at least for 1 month before you can start doing on your own. And people, हमारे पास cases आते हैं जिन्होंने YouTube देख के योगा शुरू किया है and they've got muscle fractures. So it's not just movement. It's not movement. It is a technical moving of your muscles. There's a technique involved, there is a science involved, and there is a limit involved.
Absolutely.
So all three are involved. So I think what was important today, if I have to sum up, 3 things. Fitness is not age related. Type of work, type of the movements and the quantity of movements is not age related. It is individualized. आपके कॉलर का साइज 17 है तो 17 कॉलर के लिए कमीज बनाई जाएगी. सो आपके फिटनेस के लिए क्या माफिक है वो बताया जाएगा. अगले साल या 3 महीने के बाद दोबारा असेस होगा कि आपने कितना इंप्रूवमेंट आई है. Level can be increased. Number 3, this suggestion of various forms of movement are not for bodybuilding. They are for remaining fit with a good quality of life, with multiple systems involved. Heart, bones, mind, everything. Anything else that both of you would like to say in conclusion, please?
Whatever we wanted to convey, you conveyed it very clearly, sir.
There is only one thing I would like to hear. One small point here. Consistency is very, very important. As we had mentioned earlier also.
Consistent.
So it is not
Right.
about taking something, doing it for 10 days and taking a break for 10 days.
No.
Right? So once you start slowly, steadily,
But continue
and
it.
continuously.
No
So that
one,
will be benefits.